Hi, and thank you for joining me for the COVID-19 vaccine update for long-term care providers. My name is Dr. Mark Capro, and I am an internal medicine physician and a medical director here at Simply Healthcare, looking to the managed Medicaid population. So we're going to cover a lot of different things today, just to give you a little bit of additional background and try to help you care for your patients as best possible. Our goals for the presentation are that everybody who sits through this should be able to know which vaccines are available, be able to describe in general the risks and benefits of the vaccines, identify some resources that will give you for up-to-date information, and know when and where to refer people when they have questions that you're not comfortable answering. So, in order to discuss the vaccines, we really should talk about the disease in the first place. And COVID-19, as everybody is aware of, is a novel virus. So it's a virus that we've never seen before that showed up a little more than 18 months ago out of Asia. COVID-19 causes fever, loss of smell, shortness of breath, and fatigue. For most people who get it, it can be a mild disease. Lasting 10 or more days. And there are some other side effects, and we will talk about that. People with severe disease can require hospitalization. They can have such severe troubles breathing that they require life support machines. They can have problems with blood clots, problems with their heart. They can develop other infections or become septic. And as everybody is aware, COVID-19 can cause death. While all age groups can be affected, older and chronically ill patients are at the greatest risk of dying or having a severe infection. When we get COVID-19, we know that most people will have the disease for 10 days or less, but a number of people will develop symptoms that last for at least 3 weeks or longer. This occurs in almost anybody who's sick enough to be hospitalized, and about a third of people who have symptoms from the infection. Okay, this even occurs in younger people. So we know that for our 18 to 34-year-olds, 1 in 4 will have symptoms that last beyond 3 weeks. The symptoms can be heart-related, including inflammation of the heart. It can be lung-related, requiring oxygen or follow-up treatments and studies. It can be neurologic. And with neurology, we look at things like seizures or mood swings. And there's something that's been referred to as brain fog that's been reported. These last typically for several months in many of these people. And for some people, these have lasted for more than a year. So getting COVID isn't always just as simple as getting a flu. We also don't know what the long-term effects of COVID are. And we know that many different viruses and bacteria cause long-term effects for people. So scarlet fever, which is a strep infection, causes mitral stenosis later in life. That's why we treat especially children when we see them with a strep infection. We know that certain viruses like hepatitis, HPV, those can cause cancer, and other things like polio or chickenpox can have neurologic problems that show up years later. We have no idea what the long-term effects of COVID will be because it hasn't even been around for 2 years yet. And there is no way for us to know what a late finding may be until we start to see them. So let's talk a little bit about vaccines. And we're going to spend most of our time talking about the mRNA vaccines, but I will talk about the other vaccines as well. Now, this slide is a very busy slide. You don't have to memorize it to understand what we're talking about. When we have a coronavirus, a COVID virus that's here, a COVID virus is an RNA strand, okay? And that RNA encodes for all the genes in the virus. Among those genes are genes for something called the spike protein. The spike protein is kind of a key that fits into a lock that's on many of our cells called an ACE2 receptor. And this allows the cells to be infected by the virus. Where does our body make these receptors? We make a lot of them in the respiratory system. So how do people catch COVID? They breathe in virus, which then uses its keys to unlock those cells and attacks those cells in the respiratory system. Now, in the normal course of the disease, once cells are infected, our body makes an immune response. When we've never seen a virus before, that response takes a little longer. These viruses, okay, after these cells are, so let's backtrack just a little. When the virus unlocks the cell and invades the cell, it turns the cell into a virus factory and then kills the cell. That's how a virus works. So it makes lots more of these viruses. These viruses are ultimately found by cells in the immune system that digest them and present those proteins to other parts of the immune system so that your body can make antibodies and other kinds of cells that will fight off the infection. When we do a vaccine, the mRNA vaccines especially, instead of giving you the whole mRNA, we give you just the part of the mRNA that codes for that one little spike protein, okay? And we put it in a man-made membrane that doesn't attack your cells because it isn't able to, and it only gets seen by your immune system. Your immune system then uses that RNA to present to the body the same proteins. And in doing that, it helps your body make those same antibodies and those same other immune cells that will then go ahead and fight the virus for you. Every time your body is exposed to the virus or the vaccine, your body makes more and more of these cells so it can make a faster immune response. Now, there are a lot of different types of vaccines. The mRNA vaccine that we talked about has been around for a number of years. It was first proposed about 20 years ago. The first mRNA vaccine was developed about 5 years ago for a virus called the MERS virus, which is also a coronavirus, but it wasn't needed because MERS did not become a pandemic. The other virus that we're seeing is something called an adenovirus vaccine. The other vaccine we're seeing is an adenovirus vaccine, and that's the one that you may have seen called the Johnson & Johnson vaccine. But there are other kinds of adenovirus vaccines that are in use already. Okay. So in short, there are 2 mRNA vaccines approved in the United States and 1 adenovirus vaccine. These 2 require 2 different shots. And again, that's to help amplify your immune response so you can make a very robust immune response. And this one is a 1-shot regimen. So what does the vaccine do? Well, these were all studied. They were studied in thousands and thousands and thousands of people. And most of the studies took place 7 to 14 days after the second dose for the mRNA vaccine or after the first dose for the for the Johnson & Johnson vaccine. We recommend waiting those 14 days after you get the shot before you consider yourself immune. Now, it's still unknown if we'll need later boosters, but why would we need a later booster? Again, to increase our titers and our levels for antibodies and our immune system so that our immune system is ready to fight off the virus more effectively. For the vast majority of people, the side effects are minimal and controlled with either Tylenol or Advil. Okay, the most common side effects, a sore arm, a low-grade fever, feeling fatigue, and it usually lasts 24 to 48 hours. Allergic reactions are possible, but aren't very common at all. People who are immunized and then got COVID were less sick and very rarely required hospitalization, even with the new variants that we're seeing. The COVID vaccines aren't live virus, so they're safe for anybody, even for an immunosuppressed person, but immunosuppressed people may not make a robust enough response, and that's one of the reasons why you may hear in the news that we're talking about boosters for those folks. It cannot affect your DNA. We're putting in one part of a germ instead of the whole germ, and having your body make an immune response to it. It's recommended for pretty much everybody age 12 and up. The Moderna and the Johnson & Johnson vaccine are currently only recommended for 18 and up because the studies are still going for younger people. The FDA, even though these aren't fully approved, and we'll talk about what an EUA is, only will allow a vaccine to be used in a way it's been tested. There are no costs for the vaccines, and the administration fees are paid by insurance. If you don't have insurance, the administration fee is paid by the government. Pharmacists, nurses, PAs, physicians are a lot of people that are able to do this. And the storage requirements that we had initially have gotten a lot better because of some technology that's being used in the way of coolers and other things. The Johnson & Johnson vaccine is an adenovirus vaccine. Now you may be saying, adenovirus, they're going to give me a virus. Well, we do give you a virus, but it's a virus that doesn't replicate. That virus has that one little strand of RNA attached to it, okay? It is more effective than what was originally reported, and we know that because so many people have gotten it and we're able to follow them. They are looking at 2-dose regimens as well as booster shots, but both vaccines have a favorable safety profile. Those concerns for clotting complications that you may have heard about several months ago, we know those to be very rare. How rare? We literally talk about 1 in a million kind of side effects, and that's really what we see with these. We don't see those side effects with either of the mRNA vaccines. Whenever we make a recommendation, we look at both risk and benefit. So the vaccine is recommended where the benefits of taking the vaccine are better than the risks of having the virus. People who have a specific concern because of an underlying medical issue or a previous allergy, they should address their concerns directly with their doctor, okay? And there are studies going on right now for pediatric studies all the way down to 6 months. Why is it taking so long for the pediatric studies? Because we know that children have a lower risk with COVID than adults do, but it's still not no risk. So it takes a bigger study to show that there's a benefit for those folks. We only can see what we study, and we only make recommendations based on what we see. Why do I talk to everybody about vaccines, and why do I personally recommend everybody take it? Because there's a clear risk benefit in every approved age group, okay? The technology for all the vaccines is well established and safe. I've taken it, my wife has taken it, my 17, 15, and 12-year-old daughters have all taken it as well, okay? My parents took it, my in-laws have taken it, my brother's taken it. I know very few people who have not taken it within my family. What do you expect if you're going to go get vaccinated? There's no formal script. Questions can vary, okay? They will ask if you are or should be under quarantine and if you've had COVID when you got better. They may screen you by checking for a fever, because even if you have a cold, we don't like to vaccinate people when they're sick. We like you to have a healthy immune system that's ready to learn how to make an immune response. Again, we do recommend masks for people that are not vaccinated, and you need to be observed after the vaccine to make sure that there are no side effects. Okay? And that period is recommended to be at least 15 minutes. The vaccine is not going to be required or mandated by the state of Florida's government. It can be required by employers and other folks. You are hearing in the news that more and more facilities are requiring the vaccine. It's the same way they require other vaccinations for hepatitis, flu vaccines, and whatnot. There is enough data with over 300 million shots given in the US that this is not only safe, but necessary, especially with some of the new variants that are around. How do we keep track of vaccines and who can ask for your vaccination status? Everybody who gives vaccines has to be registered in the Florida shot system. This is how we track pediatric vaccines too. And the state maintains a record of every administration. While anybody can ask you about your vaccination status, it's part of your medical record and it's your privacy. You don't have to disclose it unless you choose to. Now, if it's a requirement at work, you're going to need to disclose that. They're allowed to ask for your records, okay? And the courts allow that because if you choose not to, you're able to find work elsewhere. That's really the standard that they look at. But when we take care of patients, the standard of care isn't different for a vaccinated or an unvaccinated person. We treat people the same regardless of their choice. The same way we treat smokers and non-smokers the same way we treat anybody as a human being when they come in if they're sick. We get a lot of questions about people who may have had COVID and natural immunity versus vaccines. So there are a couple of things you should understand. First of all, nobody knows how long COVID immunity lasts. And with the new variants that are out there, we know that these variants are more aggressive. The Delta variant, you may have heard, makes 1,000 times more virus than the previous variants. So it is a lot more contagious. And if your immune system isn't really ramped up, you're likely to have a breakthrough illness and get sick. Because your immune system's already been trained, you're less likely to go to the hospital and you're far less likely to die. But you still can get sick if you've had COVID, the same way you can still get sick if you've had a vaccine. A recent study that came out just in the first week of August looked at people who are getting this Delta variant and who have had COVID and didn't get vaccinated, and who've had COVID and did get vaccinated. If you had COVID and didn't get vaccinated, you're twice as likely to get this infection again as you are if you were vaccinated even after your COVID. You also need to keep in mind that natural immunity means you're going to get the illness. There are long-term consequences of COVID. It's not just about dying. It's about a hospitalization, being out of work for at least 10 days, and a lot of things like that. We hear a lot about herd immunity. Herd immunity doesn't stop people from getting the disease. It just makes it harder to spread in a community. The recommendation at this time, if you've had COVID, is to wait until your quarantine is ended and you're feeling better, and then get the COVID vaccine. And that's what we recommend to anybody who's had COVID. How do you find out about getting vaccines? Well, the local health departments have them. You can go to Publix, CVS, Walgreens. It's pretty easy to find a vaccine nowadays. There's no effect on fertility. There was a German epidemiologist in Europe who asked to delay the vaccine approval because a protein found in placental tissue shares some features in common with the vaccine spike protein. But this really has not panned out. Number one, the issue is not just the vaccine spike protein, but the viral spike protein. So if there was an issue on fertility, you'd have the same issue with COVID. But we haven't seen it with COVID, and we haven't seen it with the vaccine. In fact, the American College of Gynecologists and Obstetricians recently recommended that pregnant patients be vaccinated all the time. All pregnant patients be vaccinated. There is no apparent issue on fertility or pregnant people. There is a much bigger risk if a pregnant person gets COVID. Can a person who's vaccinated expose someone else to the vaccine? No, because the vaccine doesn't contain a live element. You can't share the vaccine. You can share COVID. All that happens is you get antibodies, and those can't be transmitted from person to person. So if you have somebody who's vaccinated, they don't vaccinate you. They are less likely to be sick, which protects you if you're not vaccinated, but it doesn't make any difference for anything else. We don't recommend mixing and matching. Now, this is occurring in some countries where vaccine supplies are short, but there isn't any data to do so. So at this point, it's not something that is recommended. If you have an adverse reaction, you should alert your primary care provider, but you should all be aware that the CDC has an app that allows anybody to tell about their side effects. They will text you regularly to see how you're feeling and to make sure that you haven't had a problem or been diagnosed with COVID. It's one way that they are able to gather so much information, okay? There is a public database called the Vaccine Adverse Event Reporting System that's available to review current adverse events. In over 300 million vaccinations, we see far less than 1/1000% showing up in the VAERS database. So even if you want to say that, well, people aren't reporting it, far less than 1/1000%, that's a pretty small number that you have to believe is reporting it for there to be something significant. Why wear a mask after the shot? Well, number one, we know that immunity is an instant. It can take some time from your first shot. Immunity isn't perfect, and we know about these new strains now. And masks have a possible benefit and no real risk, which is why we recommend them. We weigh risks and benefits along the lines for everything, and when something has essentially no risk, but a possible benefit, especially when people are getting so sick, it's a pretty easy thing for us to recommend. People ask all the time about ingredients. What's in the vaccines? Well, there's the mRNA strand and then something called phospholipids and buffers. What are phospholipids? They're fats. Okay. What are buffers? They're things like salts and sugars. There's nothing in here that your body can't accept and your body can't normally break down. It's not really anything magnanimous. It's not a big deal. Same thing for the viral vector vaccine. It's their engineered virus, which again, isn't alive, doesn't replicate. Stabilizers and buffers, those are again the salts and things like that. Okay. So that's really what it is. Your body is able to deal with these. These come in very small amounts, right? It's not like we're pumping gallons of stuff into people. And this helps your body learn to make antibodies so you're not likely to get infected. We hear all the time which are best. All the vaccines have pluses and minuses. The mRNA vaccines seem to have a higher effectiveness, but it's a harder regimen. You have to get a second shot. Viral vaccines may have a little bit of a lower infectious on any infection, but they're very good still at preventing serious illness, hospitalization, and death. The reasons why we give vaccines aren't just to prevent death. It's to help prevent that serious illness and hospitalization that we see happening. When so many people who are unvaccinated now are going into the hospitals, it's causing the hospitals not to be able to operate as effectively, and it affects everybody's health care. It's one of the reasons why it's so important for us to get vaccinated. Now, there's a lot of questions about whether or not the vaccines are fully approved. The vaccines are authorized under something called an emergency use authorization. This means that they're believed to be safe and effective when they're used as labeled, but we're not allowed to use them outside of the labeling. So even if you have an 11-year-old who's going to turn 12 next week, it's not legal for your doctor to give that person a shot, even if the parents want to. Okay. Approvals are more broad. Okay. You can that allows physicians to decide when something and how something should be used. And those are when things are considered generally safe. Because of the number of people who've had the vaccines, it is very likely that the Pfizer vaccine and possibly the Moderna vaccine in the near future will have full FDA approval. Those will be the first ones likely. There are a number of resources that you can use to help get more information about vaccines. There are resources from the CDC, resources from the vaccine manufacturers themselves, and resources from the Florida Department of Health. The CDC also provides information for what to expect after your vaccination. And for more information, you can also reach out to the Agency for Healthcare Administration regarding vaccines and how vaccines are used in your facility. With that, if there are any questions, we would welcome you to forward those to your supervisors and to your provider relations advocates to be able to get those questions answered for you. Also, you can seek answers from your personal physicians. Keep in mind that as of today, we believe that between 90 and 96% of physicians have been vaccinated against COVID-19. That's a lot. That is 19 out of every 20. The doctors all understand that these vaccines are safe, effective, and necessary. And we, as physicians, are willing to take those vaccines because we believe that the benefits outweigh the risks. That's why we recommend them to our families and why we recommend them to our patients. Again, if you have any other questions, please feel free to let us know. And thank you for allowing me the time to speak with you today about COVID and COVID-19 vaccines.